Why is there so much abuse of technology in IVF today? This is becoming an increasing problem. The reality is that IVF has limited success rates. We're good at making embryos, we're good at putting the embryos back, but whether the embryo will implant or not is a complete black box. We have no control. Now, good doctors will acknowledge this with humility that our ignorance about implantation is far more than our knowledge. But patients don't want to hear uncertainty. They want certainty. They want a confident doctor. They want a doctor, yes, I know exactly what to do. And especially when patients have failed 3 or 4 cycles in other clinics and then go to a brand name doctor, this brand name doctor will look at it and say, oh, that doctor was useless. He didn't do this endometrial receptivity assay test for you. He didn't do this genetic test for you. He didn't give you any immune therapy. I'm going to do everything for you. I'm going to do an ERA test, expensive, 50,000 bucks. I'm going to do a PGD, expensive, 1 lakh. I'm going to do immune therapy, even more expensive, 1 lakh. But when we do all these additional tests, your chance of getting pregnant will increase. The patient is obviously very impressed. My earlier doctor was an idiot. He didn't do all these things. This new doctor is so smart. He's doing all these new tests, expensive tests. And in patients' minds, the more expensive the test, the better the test must be. Complete hocus pocus. All these tests are rubbish. They're only designed for one thing, not to increase your pregnancy rates, but to make more money for the doctor. And that's one thing they do extremely well. These tests are called add-on tests, and they add to the doctor's revenue, not to the success rates. And if you don't believe me, please do me a favor. There is a Human Fertilization Embryology Authority website run by the UK, by the HFEA, which will provide objective clinical information designed for patients because they're not trying to sell you anything. And you'll be able to learn the truth for yourself that all these tests are unproven. It's fine to use these tests in a research setting, but what really gets my blood boiling is these doctors will use these tests in clinical practice, which means they end up using their patients as guinea pigs. They'll promise the earth and the moon when using these tests. They will not educate or counsel their patients, and they will charge patients for doing these tests which have been unproven, which I think is completely unfair. Please don't let your doctor take you for a ride with all these new unproven IVF technological tests.